what is in your mind and what is in your topic. You have 10 subjects to specialize with me. Ophthalmology, brain rehabilitation, IVF, neuromuscular disorders. अब क्या पढ़ना वो तो पता चले. There are 20 subjects. मोटर न्यूरॉन डिजीज पढ़ो तो 1-2 साल पढ़ा लो उसको, वो फिर भी खत्म नहीं हो. इतने क्लासिफिकेशन, इतने ट्रीटमेंट स्ट्रेटेजीज. 10 साल ब्रेन सर्जरी करने के बाद आप पेशेंट को 10 दिन में 60% ठीक कर देते हो. उसका वीडियो आज भी अपलोड होगा. What else you want? CP child can be recovered in 10-15 sessions. He started walking. We cannot make all the CP children walk like this, but we are working with many CP children. That's what I'm saying. Ask your doubts first. Until your mind is clear, until you are enthusiastic, you cannot appear for the exam, but you can appear for the lecture also. You're coming to learn a medical subject. The medical doctors are highly enthusiastic like us. Even when I feel sleepy, we try to take our class with full enthusiasm and full energy. यानी हम हमारी थकान के बावजूद 5 मिनट की नींद पूरी करके क्लास भी करते हैं, बोन मेरो भी करते हैं, ट्रीटमेंट भी करते हैं, रिकवरी भी करते हैं, ओपीडी भी करते हैं. आज एक फेशियल पैल्सी मैंने 95% जस्ट 5 मिनट में ठीक किया, जबकि वो एक्सीडेंट किया हुआ केस था. I'm going to upload in my Facebook. 95% recovery, or 90% recovery, or 80% recovery. We have recovered a facial palsy case of 80% recovery today, right? But वो 80% की स्किल तो आनी होगी, वो इच्छा तो आनी होगी, वो फाउंडेशन तो बनाना होगा. So always in any medical college you go, 15 to 20 days, your mind is prepared to study. कि आप क्या पढ़ने जा रहे हैं. इसलिए आप अपने सवाल पूछे. फर्स्ट ऑफ ऑल यू क्लियर योर माइंड एंड क्लियर योर डाउट्स. What you can do, what you cannot do, what you want to study, what you don't want to study, and how you will study. पहले ये बात तो क्लियर हो, बेसिक बातें क्लियर होनी चाहिए पहले, क्योंकि उसके बाद तो बेसिक चीजें आती ही नहीं है, उसके बाद तो सब्जेक्ट्स आते हैं. Every medical college says about one thing. What? Basics should be clear. हम जाके थोड़ी, when we go for PG exams, you see Mohan Singh, they are so afraid of appearing an external. It's such a big subject. What question he will ask, we do not know. We don't ask them superficial questions. We ask them basic things. If they know the basics, it is enough for us. Rest knowledge is an experience. You have come for knowledge. You have not come from the bookish knowledge I have. You have come to enhance your experience with me. You are not an undergraduate. आप कोई undergraduate नहीं है यहाँ. 70 से 80% लोग यहाँ क्वालिफाइड लोग हैं, ये पढ़े लिखे लोग हैं, इन्होंने फिजियोथेरेपी पढ़ी है. उनको एनाटॉमी पढ़ाने की जरूरत नहीं है मुझे, पर उनको ये समझना होगा कि एनाटॉमी क्यों पढ़ना है, क्योंकि आज वो बातों को रिवाइज करेंगे जब सीएम पे जाएंगे, जब अल्ट्रासाउंड गाइडेड प्रोसीजर पे जाएंगे, तब वही नॉलेज काम आएगी साहब. आपकी ये नॉलेज काम पे नहीं आएगी जो आज आप बात कर रहे हैं. पीजी लेवल की नॉलेज उस अल्ट्रासाउंड लेवल पे नहीं काम आएगी. वो फर्स्ट ईयर की जो नॉलेज है, जो आज हम सब्जेक्ट क्लियर कर रहे हैं, अल्ट्रासाउंड क्लियर प्रोसीजर, सीटी गाइडेड प्रोसीजर, एमआरआई गाइडेड प्रोसीजर्स जो हम करेंगे, यानी पूरा मेडिकल इक्विपमेंट सिस्टम में जब जाएंगे, एनआईबीएस में जाएंगे, तब क्या चीज क्लियर करेगी.
Mama Hariwang, kamu tuh perutnya lihat lemak visceral udah banyak. Badan udah itu lutut, perih lutut tambah berat.
So there's a need to translate to us who don't speak Hindi all you have said.
I'm doing both the thing at the same time. What I spoke in English, I'm speaking the same thing in Hindi. I said, before you go for medical subjects, you must decide what do you want from yourself? What is your vision? What is the subject you want to work? You all are taking CP also, you are taking this also, you are taking this also, you are taking that also. How will you specialize on that? You just cannot compare yourself with me because I've given 32 years into 3, yani 90 years of practice. And I practice 21 hours a day. Can you practice 21 hours a day?
No.
Point बता देने से recovery आ जाती है, कहीं नहीं लिखा है. Just speaking about the points, do this, will not make you a specialist. Knowing about the disease, details of the disease, classification of the disease, stages of the disease, and grading of the disease is important. समझे आप?
Yes, sir.
पहले क्लासिफिकेशन ऑफ द डिजीज होता है, तो वो बातों को समझना होगा. यू हैव टू अंडरस्टैंड two things, details and classifications. A person of PSP came to me. Immediately I said, it is a terminal stage. You can take to any hospital in the world. There is only one treatment, IGV therapy. If you want to give IGV therapy, spend 25 lakhs and then you spend another 25 lakhs and take a dead body at home. But when he came here and he saw our system of treatment, he was so impressed that we are giving him stem cell therapy at 5,000. How was it possible? Because my knowledge was skill, I spoke to the physician in such a way, things have started happening here. The hematologist was there, pathologist was there, and anesthetist was there. We have top-notch orthopedic surgeon from Mumbai. Why can't we do all those things here? Why we need to pay 1 lakh rupee, 2 lakh rupees per injection to them? And I tell you, by giving this, I thought it is a fake, but when I saw, oh, it's really good. Results are excellent. People have started eating food. I saw MND-ALS case, was unable to eat food. After the treatment, he started eating food. और क्या चाहिए आपको? आप क्या मड़बे में जान फूकने की सोच रहे? पॉसिबल है ये? विधि का विधान बदल सकते हैं आप? नहीं. But you can recover a patient to a certain stage where he can live a comfortable. Don't think beyond medical science. Don't think about miracles. Think of what is possible. Right? Am I clear to all of you?
You're clear, sir.
Yes, sir.
Sometimes you're asking me CP. Sometimes, you know which kind of CP it is? Hypoxic insult. Brain में कितना damage हुआ है? Grade 1 spasticity, grade 2 spasticity, grade 3. All this you do not know. You just take and you tell me to tell the treatment. If you know everything, then you can treat the disease also. So most important part of any medical diagnosis is the diagnostic part. Your clinical as well as your diagnosis. So this too I'm going to teach in fellowship class. Once you cross the stage of 150, I will start teaching. Because if you go to any institute in India, the cost of what I am teaching is more than 5 to 10 lakh rupees per year or for 6 months. You go abroad, you go to China and see for 6 months how much they charge. I have all the slides of the engineering university. I can make you what the engineering teaches, what this teaches, what that teaches. I can teach you all this. What Shanghai teaches. Shanghai University में क्या पढ़ाया जाता है? नेंजिंग यूनिवर्सिटी में क्या पढ़ाया जाता है, तेंजिंग यूनिवर्सिटी में क्या पढ़ाया जाता है, वो सारी स्लाइडें मेरे पास है. My Nepali students have done their MS and PhD from there, MD and PhD from Nepal, from China. So I have entire course material of them. But what they lack is the modern diagnosis. What you lack is the understanding of a disease. Disease किस तरह से आगे बढ़ रहा है? Is it the symptom of the treatment you did, or is it the symptom of the disease? These are two things which will overcome. ये disease का symptom है या disease का आपके treatment का side effect है. For example, I gave a ciprofloxacin. Next day I saw he's having constipation. Is he having constipation because of the nature of the disease or because of antibiotic? That must be in your knowledge. ये बेसिक बातें अगर हमें नहीं समझ में आती है आज, कल क्या ट्रीट करेंगे हम, क्या ट्रीटमेंट? आज एक एमआरआई की स्कैन देखना नहीं आता, एक एक्सरे देखना नहीं आता, एक फ्रैक्चर समझ में नहीं आता. आफ्टर स्टडिंग बीपीटी आई हैव सीन, you cannot even interpret me totally the anatomy of the brain. थोड़ा बहुत बता रहे हैं. Is it okay to treat the patient? You do not know the pathway of cerebral artery. You do not know the Robinson's show. आपको रोबिन्सन शो क्या है ये नहीं मालूम, आप स्ट्रोक को ट्रीट कर रहे हैं. इसलिए आप अनसक्सेसफुल हो रहे हैं. आप अपने अनसक्सेस का कारण खुद है. सक्सेस लाने के लिए सबसे बड़ी चीज है अंदर में आत्मविश्वास लाना. और आत्मविश्वास कब आएगा? तब जब आपकी नॉलेज एक लेवल पे होगी. आज में जैसे एक एमडी फिजिशियन आता है, डीएम आता है, मेरे पास तो सारे आते हैं यहाँ. ऑप्थेल्मोलॉजिस्ट भी आता है, ये भी आता है, वो भी आता है, सारे तरह के पेशेंट आते हैं, सारे तरह के डॉक्टर्स आते हैं, सुपर स्पेशलिस्ट भी आते हैं, राइट. ए 23-year ऑर्थोपेडिक सर्जन भी आता है. I get 23-year-old senior most orthopedic surgeon of a state who has done 3,000 knee and hip replacement. Can you buffle him? Can you misguide him? No. Why? Because my foundation is strong. And same foundation you should have. The foundation you build today will be for 100 years till you die. And no one can take it from you. आज जो आज फाउंडेशन आप बना रहे हैं मेरे साथ, वो आपके साथ 100 सालों तक है. मैं ये बोल रहा हूँ विशुद्धि लिख रहा है एक्यूपंक्चर में 4 दिन में कोर्स. Is it possible? I took more than 2 years to write the book. एक सॉफ्टवेयर बेस पर क्या पेशेंट का ट्रीटमेंट हो जाता है? उसको पूछो तो सही डायग्नोसिस और प्रोग्नोसिस क्या होती है. What is the prognosis of the disease? पीएसबी क्या होता है, ये क्या होता है, मोटर न्यूरॉन डिजीज का क्लासिफिकेशन तो पूछो. जाके सवाल तो पूछो लोगों को जो आपको पढ़ा रहे हैं, उनको सवाल तो पूछो. गो एंड आस्क हिम क्वेश्चन whether he is really a teacher or not. I'm not saying about Leo or anyone, with due regards to him. First ask him whether he really knows the classification of what he is teaching. It's impossible to teach 10 Johns in one day. If I start teaching tongue, I'll take more than 1 year of teaching tongue. There are more than 10,000 combinations. And shortly we'll start tongue classes, very shortly. मुझे मास्टर टंग लिखने में 2.5 साल लग गए. दिन में काम करते थे, रात को ग्राफिक राइटर को लेके बैठ के लिखते थे. And then I used to practice on each point. I used to go to villages and I used to practice whether I am right or wrong. Brad Wisnet, Vechi Young, all were against me because they were selling the book at very high cost and I am giving it free of cost. Lotus में मुझे disband कर दिया because they thought that I breached the breach of conduct. I said, how can I breach the conduct? I have written my book. You are copying my book. My points are very clear. I read this book. I have given my classification. And the basic things cannot change. The anatomy written by Chaurasya or an anatomy written by Bhattacharya cannot change. Every author, whether it is Bedwisnet, whether it is Vechian, कोई भी हो, मुख्य बातों को change नहीं कर सकते आप. And today I am very much comfortable in Tung acupuncture, TCM and Japanese technique in such a way that you bring any third master from Japan and let us see what he can do and what I can do. Why? Because of my clinical practice with 140 patients every day. I see every stage of recovery and infection. I maintain the infection with other doctors. I consult with other doctors. Many doctors, they visit these patients. We have a detailed discussion. तब जगह कई बातों को समझ में आता है. बीमारी इतनी आसान नहीं है जैसे आप लोग समझ रहे, सुई मारा और दर्द ठीक हो गया. अरे क्या चीज का दर्द है ये? नर्व कंप्रेशन का. You have a pain of nerve compression. Is it so easy? I take Siam for that, buddy. And you are doing just this point, that point, this point, that point, putting the cup here like this, putting this, putting that. I don't know what you are doing. And some are going to the extent of chiropractic techniques. KVR Sastri, the head of the Niemans, director of Niemans, said in his direct meeting, he said, in any type of disc prolapse, the patient should not go for any type of physiotherapy until he is stable. और आप लोग क्या करते हैं? पहले आते ही फेसर जॉइंट्स खोलते हैं. It is not possible, ना? You see the prescriptions? You see the prescriptions of the neurosurgeons? When the body needs rest to get the fibrosis of the disc को बचाने के लिए जो फाइब्रोसिस चाहिए वही बना नहीं पा रहे आप. उसको बार बार इंजूर करके तोड़ रहे हैं. इसका मतलब क्या हुआ? चलिए आज की बात बताता हूं. पूरा नर्व इंजुरी है, फेशियल इंजुरी है. 10 मिनट में फेशियल बेल स्पाइल से कैसे रिकवर हुआ 90%? ये बताइए आप. After 2 months of physiotherapy you have done. The statement I'm going to upload today right now after this. Go and check in my Facebook. Patient came with 10% hope. I gave 90% recovery in one day. Why will the patient not come? आइए हम सिखाएंगे आपको. हम थोड़ी ना पैसे मांग रहे आपको सिखाने के. हम थोड़ी ना इस क्लास के पैसे मांग रहे हैं. बात पैसों की नहीं है. बात है आप क्या करना चाहते हैं. फर्स्ट ऑफ ऑल आपके पास आधा अधूरा नॉलेज है. I see all the PPTs. I work with NITARs. I work with Padma Shri. I work with F.R. Muller. I work with their professors. And then I have seen what is their knowledge. They are the top 10 medical college, physiotherapy college of India. And they do not even know how to hold the patient. I just said, you hold him like this and she will walk. कितना आसान स्टेम सेल बनाना पता नहीं. इतना कॉम्प्लिकेटेड क्या प्रोसीजर. I don't know why things are so complicated. They may do culturing, they may do other things. I don't know what is their procedure, with all due regards to them. But with this process also patient can recover. This is my practical example. And this is not I am doing. This is MD medicine doing with me. This is a DM doing with me. This is a MD anesthesiologist doing with me. जो प्रोफेसर HOD है वो कर रहे हैं मेरे साथ काम. वो तो गलत नहीं हो सकता है ना. Medical fraternity cannot be wrong. That's what Mohan Singh said. I have uploaded a video in medical fraternity. Mohan Singh साहब ने एक वीडियो पैरालिसिस पेशेंट जो रिकवर हो गया उसको अपलोड किया, तो बहुत सारे लोगों ने उस पर कमेंट किया। लास्ट में मोहन सिंह साहब ने एक लिखा, डू यू हैव द गट फीलिंग टू रिकवर द पेशेंट? इफ यू हैव, प्लीज कम ऑन एंड स्पीक ऑन टू मी ऑन द टेबल, एंड इफ यू डोंट हैव, प्लीज स्टॉप स्पीकिंग नॉनसेंस। I am also a professor and I am also an HOD. That is what Mohan Singh wrote. मैं क्यों खरीदा न्यूरोसर्जिकल माइक्रोस्कोप? आपको ये दिखाने के लिए कि ब्रेन देखो कितना सोफिस्टिकेटेड है, कितना कॉम्प्लिकेटेड है, उसके सर्कस कितने कॉम्प्लिकेटेड है, कितना नैरो स्पेस है, और उस चीज को आप सब पुटेनियसली जाकर रिकवर कर रहे हैं यहां से। यू आर प्रोसेसिंग व्हाट? the muscle recovery instantly from here, but you do not know which muscle to recover, how much to recover, how much power to be given, how will you recover a disease? ये बातों को समझना होगा कि हम आज किस गहराई में उतरना चाहते हैं? You see, this is what I said. Think like a surgeon and act like a physician. सर्जन की तरह सोच होनी चाहिए। मैंने तुरंत सर्जिकल सोच लाने के लिए लक्ष्मीनाथ से बात की, and we are going to do what? Whenever we have time, we are buying neurosurgical microscope with 2 binoculars and we'll practice neurosurgery in our leisure time on chicken meals and other things. I'll improve my teaching skills. Still, my teaching skills are not good. I'm improving it. अब एक बात, छोटी सी बात सोचिए कि आई एम ए फिजिशियन from a acupuncture side, but for me to take out a tumor is not a big question. To understand what he is saying and what is his approach and what will be his deficit, मुझे समय नहीं लगता वो न्यूरोसर्जन की बात समझने में। क्यों? I just attended few lectures of IP Cherian and I kept my studies continued with what? YouTube. Now my mind is well developed. Now I can understand things. Now I have to practice to open my mind. वो माइंड आप लोग भी लाइए ना, मुझे तो यही समझ में नहीं आया, क्यों नहीं ला सकते आप में हर काबिलियत है, यू आर कैपेबल, बल्कि दुनिया को आपकी सबसे ज्यादा जरूरत है। वी आर फाइनेस्ट न्यूरोसर्जन्स बट जीरो रिकवरी इन दिस वर्ल्ड। 50 साल पुराने लोग हैं पैरालिसिस के जरिए, 20 साल पुराने, 17 साल पुराने केसेस है। वी हैव 17 years, 18 years, 20 years old case and we are not able to resolve it. Why? Because your determination is low. If, for example, 5 minutes power nap I took, why? I was tired. Now you see how nicely I am giving the lecture. अब लेक्चर की स्पीड देखिए। हम आंख बंद करके इसलिए बोलते हैं क्योंकि the light of the camera falls in my eyes. It disturbs my eyes. So what did I do? I interpret the script in my brain. क्या बोलना है आपको, क्या समझाना है आपको? पहला ये समझाना है कि आपको फिजिशियन बनना है या नहीं बनना, पहले वो डिसाइड कीजिए आप, क्योंकि एक छोटी जर्नी नहीं है ये, 2-3 साल लगेंगे, बट 2-3 साल में खाली नहीं जाएंगे, बहुत कुछ करते जाएंगे आप। जब मैं एक ड्राइवर को सिखा सकता हूँ पैरालिसिस ठीक करना, मेरा ड्राइवर एक्सरे टेक्नीशियन बन सकता है। It takes better एक्सरे देन एक्सरे टेक्नीशियन। उसका एक्सरे मुझे समझ में नहीं आया, मैंने अपने ड्राइवर को बोला भाई तुम उसको लेटरल पोजीशन को थोड़ा सा टिल्ट करके मेरे को एलएस स्पाइन लेटरल निकाल के दो. My driver did it. In 5 minutes, and he gave me the X-ray. I said, "There's a tumor in this patient." पहले का एक्सरे और इसके एक्सरे में देख लो आप. एक ड्राइवर एक्सरे टेक्नीशियन बन सकता है जो सारा क्लास 7 पास नहीं है. Why can't you all become a good physician? You have a good characteristics. You have a good qualities. Only what you need is what? Determination. The determination will come from where? From your understanding of knowledge. From your grip of knowledge. आपको नॉलेज पर कितनी पकड़ है, एक बीमारी पर आपकी कितनी पकड़ है. आज मुझे कोई भी पैरालाइसिस दे दो, मैं बोला आपकी आधा कप चाय पीने से पहले मैं आज को 50% रिकवर कर देता हूँ. चलिए कंपटीशन लगाते हैं. I said a neurologist, सर ये करे एक कप चाय और ये रहा आपका पेशेंट, चलिए कंपटीशन हो जाए. 70% ब्रेन डैमेज है ना, चलिए सर कंपटीशन हो जाए. आधा कप चाय और मेरा आपका पेशेंट. And when he saw the initial movements and the initial recovery, he said, "Mr. Sastri, you won the challenge. Before my half cup of tea is finished, you have done it. If I was a dean of this college, I would have said, please offer him this seat. You are the one who can make real students." एक मेडिकल कॉलेज के डीन ने मुझे ये एक जवाब दिया कि अगर मैं इस कॉलेज का डीन होता, he was HOD, उन्होंने बोला कि कॉलेज को ऐसे प्रोफेसर चाहिए जो आपके अंदर की छुपी हुई क्वालिटीज को ला सके बाहर. कि आप लोग पैरालाइसिस ठीक कर सकते, बहुत बड़ी चीज नहीं है पैरालाइसिस, बच्चों का खेल है. परेशानी क्या है? हमारा फाउंडेशन क्लियर नहीं. हम इधर उधर से पढ़ के आए हुए लोग हैं, एक हमारा रिपोर्ट भेज देते, उसकी इंटरप्रिटेशन मांगते, न्यूरोप्लास्टिसिटी के बारे में कुछ नहीं जानते. फॉरगेट अबाउट यू. कल एक पीजी सर्जन आया, मैंने उससे 4 सवाल पूछे, उसको उसका जवाब नहीं मालूम. I said, I have recovered this patient. Explain how I recovered this patient. A patient was referred by him. He's a PG 3rd-year resident. He said, it's a case of 4th-year ventricle operation. I'll upload this video also. He has been bedridden for 6, how many?
6 years.
Correct. Why was he bedridden for 6 years? And how did I recover him in 15 days by 60%? We have stopped giving him wheelchair. He came on wheelchair withdrawn in 10th day. He's climbing staircases. कैसा possible है बताओ? मैंने पूछा उसको. So that is the point I don't understand. Subcutaneous needling. Subcutaneous means muscular needling. What you call scalp is a muscular needling. Can recover a paralysis patient in after 6 years of brain damage, 4th ventricle, it also near the brain stem. Yes, definitely possible. Because you do not work with the cerebellum, you do not work with this. I created a pathway. Cerebellum, spinal, and peripheral. Because my concept was clear. You know what is that? You want to know what I do? When a patient comes to me? Who wants to know?
Me, sir.
Yes, sir, we want to know.
I want to know, sir.
Yes,
What
sir.
I think?
We want to.
When a patient comes for 30 minutes, I talk nonsense with the relatives and other patients, right?
Yes, sir.
They're thinking I'm doing something nonsense. But no, I'm thinking out of 2000 procedures which I know, which is the best for him. I apply each procedure on him. I imagine this will recover. No, this will, oh, this is a limitation of this. I find this will do. The moment I know this will do, the patient recovers in 1 minute. That should be the skill. And I was very happy today. I reposted. You go to my Facebook, Dr. Nirvane, orthopedic surgeon who came all the way from Mumbai to learn from me. He proved I was right. Within 2 seconds, he recovered the patient. 2 to 3 seconds by watch. He was so excited, he called me up. Sir, 2 seconds में patient recovered किया है. Can you do that? We all can do that. उन्होंने तो एक्यूपंक्चर का एबीसीडी भी नहीं आता. ऑर्थोपेडिक को कितना आता मुझे भी मालूम है. सिलेबस क्या मुझे भी मालूम है. पढ़ाया ही नहीं उनको ये सब चीज. फिर भी उन्होंने जीरो से चालू किया मेरे साथ. The orthopedic surgeon started with zero. And now what he is saying? We are united. I said, yes, definitely. Your knowledge, my knowledge will help the people. And we are going to do things which will help the people. That's it. Because success stories are there. Huh? Learn to create success stories. You will get marks for your successful stories, not unsuccessful. आप जो सक्सेस कर पा रहे हैं वही आपका क्रेडिट है, वही आपका नाम बढ़ाएगा. I have seen Ramesh Ramduran, the patient who came to me, the patient he refers me. By the quality of the patient he refers me, I understand how far he has gone. He was just a what? Medical representative. And today in his area he is known as a very good expert of nerve specialist. Imagine. He refers me the most toughest cases. But what tough case उसके पास पहुंचे कैसे? That means what? He is famous in that area for recovering this type of patients. How he became famous? Not by putting ads and hoardings. There is no M.K. Sastri has no hoarding in Hyderabad, no board in Hyderabad. Why my hospital is full? Why am I thinking of spending 6 crore rupees as from Bangalore to buy MRI and CT scan? मैं 6 crore रुपए का MRI CT scan क्यों खरीद रहा हूँ Bangalore लेके? So that we can prove with evidence we are right. और ये 100 सालों तक ये एविडेंस रहेगा जो लिख के जा रहे हैं हम. किसी की हिम्मत नहीं होगी ये बात बोलने की कि है ना एक्यूपंक्चर से नर्व डैमेज हो जाता है, एक्यूपंक्चर से ये हो जाता है, एक्यूपंक्चर से वो हो जाता है. ढंग से करो, कुछ नहीं होगा. Do it carefully, nothing will happen. What we cannot do and what we can do, but we must understand. मेरी बात यहाँ खत्म होती है. अब आपकी बात और क्वेश्चन चालू होते हैं.
सर नमस्कार, मुकेश रावत उत्तराखंड.
रावत जी, प्लीज टेल मी.
सर अभी जो बोन मैरो से आप स्टेम सेल्स ले रहे हैं उसमें, और जो पहले आप पीआर मतलब ब्लड सेल से
नहीं हम ब्लड वाला तो लेते हैं, बट जो
सर दोनों के रिजल्ट में क्या डिफरेंस है?
नहीं देखिए, मैं जो तरीके से प्रोसेस कर रहा हूँ, आई एम गेटिंग वेरी गुड रिजल्ट इंटीग्रेटिंग बोथ.
ओके सर. मतलब यदि हम सेपरेटली सर ऑब्जर्व करें
हम
तो
दोनों
पहले
कर रहे हैं. मैंने सेपरेटली करना छोड़ दिया क्योंकि मेरे पास इतनी टाइम नहीं है ना कि एक पेशेंट मेरे पास 6 महीना थोड़े ना रहेगा.
जी सर, जी सर.
क्या आप पेशेंट को 6 महीना रोकना चाहते हैं यहाँ?
नो.
डू यू वांट टू गिव ए पेशेंट 6 months विथ मी?
नो सर, पेशेंट मैं चाहता हूँ कि जल्दी से जल्दी रिकवर हो.
तो जल्दी से जल्दी जो कर सकते करके खत्म करो.
ठीक है सर. थैंक यू सर.
मैंने देखा weekly twice we can take from bone marrow, right?
Yes, sir.
So take it from there. Rest alternatively take it from the this process it. You'll love to know when I compare both the tubes, sodium chloride tubes. I see
Sorry.
the stems in both the cells are very beautifully seen, is a thin layer. There are 3 layers.
Yes,
I
sir.
try to actually क्या वो खराब हो जाता, नहीं तो मैं क्लास क्लियर रखना चाहता था. But 3 layers are there. 1, 2, 3. Dr. Sonia has taken the photo. I don't know whether she is here or not. I asked her to give you the photo. So there are 3 layers. The first layer is of the stem cell, then is the plasma, and then the RBC. जो फर्स्ट लेयर होती है एकदम छोटी सी होती है, इतनी सी.
Yes,
सेकंड
sir, I
प्लाज्मा
have
इतनी सी,
seen.
and then RBC. But when I processed from the blood, I got the same results. Otherwise, why the patient will demand? माथा खराब कर दिया डिमांड कर करके. मेरा कब होगा, मेरा कब होगा, मेरा कब होगा. आज हम लोगों ने सोचा था 8-10 केस करेंगे एक दिन में, राइट?
Yes, sir.
हेमाटोलॉजिस्ट ने 4 केस करने के बाद बोल दिया मैं तो थक गया सर. मैं बोला सर मैं भी थक गया. 4 में हम तीनों थक गए. कल के लिए पोस्टपोन कर दिया. सब बाहर बैठे थे. बोला we surrendered. We cannot do more than 4 cases a day. Because after 4 cases और भी तो काम है ना हमारे.
Yes.
We have to preserve our energy for other work. क्लास लेना, ये लेना. देखो आज मैंने स्टेम सेल के क्लास में आके क्या हालत हो गई मेरी. I cannot even open my eyes. प्रकाश जी की डांट पर इतना आँख खुली. अभी मैं क्लास में हूँ. डांट तो हमें भी पढ़नी चाहिए भाई. हम कौन से माँ के छुपे हुए रुस्तम है. Ask your question. See, after that, you won't get the chance to know all these things. So whatever is in your mind, you ask.
Sir, good evening. Vandana here from New Delhi.
हाँ वंदना बोल बेटा.
Sir, my question is, in
बेटा
the
थोड़ा जोर से
interest
बोल.
with you.
मेरा सुनाई नहीं दे रहा है.
जी सर.
कान. Actually
जी
ये
सर.
सारे दिन वो
Sir.
चुन चू सुन के ना कान अब कान भी नहीं काम करता.
जी sir. Sir, if somebody has all the right determination, as you said, and all the passion, what are the basic principles you will guide to become a strong acupuncturist?
See,
Because
basic principles are
as I
always.
always say.
See बेटा. Now and the real answer is the basic foundation come from the anatomy, physiology, and other medical subjects. आपको वो हर सब्जेक्ट पढ़ना होगा जो मेडिकल डॉक्टर पढ़ता है, बट इन ए स्मॉल वे. क्यों? क्योंकि फार्माकोलॉजी इज नॉट इंक्लूडेड हियर. साइड इफेक्ट्स ऑफ द मेडिसिन आर नॉट इंक्लूडेड हियर. डिजीज एंड प्रोग्रेशन ऑफ द डिजीज इज इंक्लूडेड. तो एक पार्ट ऑफ सब्जेक्ट इंक्लूडेड है, एक पार्ट फार्माकोलॉजी जो टिपिकल सब्जेक्ट है. फर्स्ट लाइन ऑफ ट्रीटमेंट, सेकंड लाइन ऑफ ट्रीटमेंट, थर्ड लाइन ऑफ ट्रीटमेंट, वो भी आपको जानना होना चाहिए. क्यों? क्योंकि ऑलरेडी पेशेंट आपके पास, who will come to you? The patient who has been treated by all the physicians. मैं आज आयुर्वेद को क्यों इतने अच्छे से जानता हूँ? मैंने देखा अरे लक्ष्मी विलास दिया है, ये क्या दिया है? मस्कुलर डिस्ट्रोफी में लक्ष्मी विलास रस का क्या काम है?
Right, sir.
फिर देखा उसने क्या कर रखा, RMP का रखा, तो ये लिखेगा आयुर्वेद रत्न है. सबसे पहली बात है डायग्नोसिस. पहली बात है बेटा एनाटॉमी फिजियोलॉजी. सेकंड पार्ट, हर डिजीज में ऑप्थेल्मोलॉजी में क्या क्या डिजीज आता है, गायनोकोलॉजी में क्या क्या मेन डिजीज आता है. मेन डिजीजेस ऐसे तो ये अथा रामायण है. फिर ऑर्थोपेडिक्स में क्या क्या आता है, न्यूरोसर्जरी में क्या आता है, न्यूरोसर्जरी कैसे की जाती है, वो सब का एक ब्रॉड लाइन आपको समझना होगा. तो 6-7 महीने में समझ जाएंगे. समझने में टाइम कितना लगता है, दिखाया और समझा. भाई यूट्यूब में जाओ, डिटेल पढ़ लो, हो गया. शाम तक एक्सपर्ट हो गए उसके. 4 लेक्चर अटेंड किए, हो गए एक्सपर्ट. कोई बहुत बड़ी चीज नहीं है ये। अब एक कौन बात कर रहा था मुझसे ओवर देयर?
Sir, Vandana from Delhi, sir.
वंदना, एक ड्राइवर की क्वालिफिकेशन क्या होती है?
Maybe not even a higher secondary sometimes, sir.
क्लास 8, 9, right? 7, 6, 8.
Right, right.
Can you make him an extra technician in 2 months?
It's very difficult until he gets the right mentor and he has the right passion.
Why right, mentor?
and
I paid another extra technician 30,000 rupees. Teach him or I'll not pay him. He taught him so perfectly, he became an expert.
Right, sir.
Now, wherever the driver goes, my headache of extra technician is finished. He takes all the extras. I get immediately the flea. The topic is over. Otherwise, you wait for 2 o'clock because all these nursing homes have temporary extra technicians. They come at 11 o'clock, they go at 2 o'clock. Because the patient is not there, right? The nursing homes. They go to the corporate hospitals. Only very lower middle class patient comes to the nursing homes.
Sure, sir.
मेरे पास कौन आता है? या तो मरने वाला आता है या मरने से कुछ दिन पहले आता है। फिर बोलते आप कुछ कर सकते हैं क्या? मैं हमेशा बोलता हूँ मैं अब इन पेशेंट से पूछो मैं क्या कर चुका हूँ। My counseling to the patient is what? Room number 202, 203, 206. I have treated this patient. Go and talk to them. If they say yes, yes. If they say no, no. Decide in 15 days whether the father is recovering or not. नहीं समझ में था जाओ. And they have not come from directly to me. They have come from Yasoda. They have come to the best neurologist. Everyone said no, and then I am taking the patient. तो फाउंडेशन लाने के लिए तो बेटा पढ़ना पड़ेगा और आजकल तो बहुत सुविधा है, यूट्यूब है। मैंने जो लेक्चर की टॉपिक्स ली वो थोड़ा यूट्यूब पे जाके चेक कर लो, सामने एक्सपर्ट हो गए उसके। 4 प्रोफेसर की भाषा सुन लो। आजकल पीजी के स्टूडेंट्स ये कितने अच्छे लेक्चर्स आ रहे हैं, डॉक्टर नजीब के इसके वो सुन लो, सब कुछ क्लियर हो जाएगा कॉन्सेप्ट। कहीं जाने की जरूरत ही नहीं है, मोबाइल पर ही क्लियर होता है।
Yes, sir. Sure, sir. I'll take a note, sir. Sir, I will execute.
नजीब है और एक हार्वर्ड यूनिवर्सिटी का प्रोफेसर है, दोनों के लेक्चर्स बहुत अच्छे हैं। वो बड़े बेसिक से अच्छे से पढ़ाते हैं, पढ़ो उनसे, उनके लेक्चर्स पढ़ो, मेरे लेक्चर्स पढ़ो, क्लियर हो गया सारा काम।
Yes, sir. Sure, sir. Noted, sir. Thank you so much, sir. I'll take this as the first step, sir.
See, I'm not saying you cannot do. Shortcuts are also there. But after 3 years or 4 years, what will you be? A shortcut or a good physician?
Sure.
हमारा कोर्स तो 6 महीना, बट उस 6 महीने में ऐसा फाउंडेशन बनाना है कि आप आगे जाके खुद एक अच्छे फिजिशियन बन सके। Your mindset should change. My work is not to give you knowledge. My work is to change your mindset, bas. Instead of watching movies in YouTube, watch this type of lectures.
Right, sir.
क्या पढ़ना है, क्या सिलेबस हो गया। फिर देखो 6 महीने बाद कितना अच्छा माइंडसेट आता है, क्या कॉन्फिडेंस आता है।
Right, sir. Sure, sir. Thank you very
लोग
much.
अपने आप जुड़ेंगे आपके साथ, जैसे आप लोग मेरे साथ जुड़े हुए।
So my next follow-up question to this is, एक बार ये basic principles को इसको strategize करके, then is there a way that we can get I know you have a very very hectic schedule with all the renowned doctors who are specialized, but after a person is little tenured with this knowledge, would you allow a person to get into some classes with you so that the person can learn the art
I
of
always say most welcome. Did I say not welcome? Hey, tell
Absolutely.
me anyone, did I say not welcome?
No, no, you're always welcoming everyone, sir.
Then why this question is coming?
This was just to clarify.
I already
So that
clarified on the first day. All are welcome. I'm an orphan. In an orphanage, everyone is welcome. When the patients are welcome, the attendants are welcome. Why you are not welcome? अच्छा डांट मारने को कोई तो मिला, गुस्सा निकालने के लिए कोई तो मिला.
sir, आपकी डांट में भी sir, there are good teachings, sir. So I take it with all the optimistic.
वो डांटने का तरीका, हम डांट नहीं दे, वो हमारे पढ़ाने का तरीका है.
जी sir, जी sir. It's
क्योंकि आप लोग ने
that's the
मेडिकल
best
कॉलेज
teaching.
अटेंड नहीं किया तो आप लोगों को मालूम नहीं है कैसे पढ़ाया जाता है. राइट.
हाँ जी, हाँ जी.
एक सीनियर लोग से पढ़ने में उनकी टोन में क्या डिफरेंस होता है और एक जूनियर लेवल की टोन में क्या डिफरेंस होता है वो आपको मालूम नहीं है. राइट.
Right, sir.
बस टोन का डिफरेंस है. मेरी टोन थोड़ी जरूर है क्योंकि मैं पहले से रगड़ देता हूँ, गाजर की तरह रगड़ता हूँ. गाजर को जैसे घसते हैं ना, हाउ डू यू कट द कैरेट लाइक दिस,
Right.
and from the very first day I start doing like this.
Grating.
Yes. When I
Grinding.
go to Karat, I ask the surgeon, what do you know? You don't know twitches? Also, I also don't know. But you see my confidence? Oh, this patient gone.
Right, sir.
You believe. My best friends are why neurosurgeons, orthopedic surgeons. Because we work together. Sastri ji, ये तो कर दिया आगे, आगे मेरे मत्थे मार दो. हाँ सर. Sir, my uncle, my driver's daughter cannot walk. Can you help me? 100%. She will work. She is having grade 4 spasticity. होगा. अपने घर पे होगा grade 4. मेरे घर पे तो नहीं है. You understood?
Yes, sir. Yes, sir. Very well, sir. Thank you, sir.
See, whenever a doctor comes here, visiting doctor also, I say you go and take round. I tell the nurse, take the case history and go. Take all the case files and go room to room. Take this doctor and ask the doctor what treatment was done, how you recovered, what was the stage when you came here, and whom you have seen. Say that also. First word they will say, they have seen the best neurologist. He said nothing can be done. Here this treatment was done and this is my recovery. That is why the MD medicine said, what you want to ask about the recovery of the cases treated by Mr. Sastri, please ask me. एक MD मेडिसिन बोल रहा है आपको, जिसने मेरे साथ 5 महीना काम किया, वो तो मेरा भाई का जैसा हो गया. You know what good relationship. आप लोग बोलते हैं कि पंचर से एलोपैथी वाले दुश्मन है. वो मेरा इतना अच्छा हो गया कि he is now my bank nominee. I am an orphan. I said, who will be my nominee? मैंने अविनाश को फोन किया, भाई I am no one to be nominated. तुम ही नॉमिनी बन जाओ. He is a nominee of my savings account. He is a Christian. But मैं हमेशा उसको ये बोलता हूँ कि I don't want to die with like your orphan. मेरी अंत्येष्टि तुमको करनी होगी. Mohan Singh, cardiac anesthesiologist, professor HOD of #1 Medical College of India in anesthesia. Right? उनको पापा बोलता पापा मेरा पिंडदान आप करना होगा. How come? Why they respect me so much? Only because of the recovery, dedication and sincerity I saw in my clinic. Why people will respect you? Why the bank manager, AGM himself comes and prepares the account for my loan? AGM खुद आगे मेरा प्रोजेक्ट ठीक कर रहा है क्योंकि उसकी बेटी को मैंने रिकवर किया.
ഇനി സമയം വേഗമാവട്ടെ. ഗ്യാസ് ഇല്ല, ഫ്രീസർ നമ്പറായി.
बंद करो गाना. ऐसे तो स्टूडेंट है
Mr. Abdul, you have to mute your phone. Mr. Abdul. Mr. Abdul. Yeah. Thank you.
लेक्चर सुनते हैं ना गाना सुनते पता ही नहीं एनीवे और पूछो भाई आस्क क्वेश्चंस
Thank you, sir. Thank you
So-
so much.
Hello, sir.
Sir, I have a
यस
question.
डेफिनेटली हेलो भाई
Sir,
Sir,
I'm
you are,
from India.
हाँ
Question: If a
hello.
person is drooling, normally, normal person, if he is drooling, what can be the treatment, or is it okay to leave as it is?
see the question is how will you develop this brain
Sir, probably it might be due to like acid reflux or irritation with the food pipe lining.
whatever it be the command is to come from where
Pardon, sir?
to recover this type of patient the command is to come from where who will recover the brain
Okay.
right
Yes, sir.
do you know how to talk to the brain what is the language of brain
The stimulus.
signal
Yes, sir. Stimulus. The stimulus we send to the brain.
yeah stimulus which you send to the brain and it has to reach a certain threshold यानी उसका एक थ्रेशोल्ड होता है यानी यहाँ से यहाँ तक आएगा तब काम करेगा अगर यहाँ से यहाँ तक आए तो काम नहीं करेगा तो इसको दो बातों में बात किए जाते हैं एक्शन पोटेंशियल एंड मेम्ब्रेन पोटेंशियल सी until it reaches the proper threshold the chain of command will not take place it was written a very good book spark in the machine if the spark is proper you will recover the patient अगर एक सही स्पार्क दिया जाए तो पैरालिसिस ठीक होता है मैंने तो दिखाया है हर सेकंड दिखाया है कि स्पाइन में अगर सही ढंग से नॉर्मल सलाइन का कॉक्यूल मार दो नवरूटो डर्माटोमायोटोम देके पाँव की स्पास्टिसिटी ठीक हो जाती है टाइटनेस ठीक हो जाती है विद इन ए मिनट
Yes, sir.
कमी आप में आप लोगों ने आज तक पढ़ाई आई एम सॉरी टू से रिसर्च किया बेटा कितने रिसर्च पेपर पढ़े इसके ऊपर बताओ कौन से पेपर पढ़े बताओ
Sir, I am currently a BPT second year student. So
सेकेंड ईयर हो या थर्ड ईयर हो या फोर्थ ईयर हो रिसर्च पेपर पढ़ने में कुछ जाता है
no, sir.
तो क्यों नहीं पढ़े
Sir, just this question came around my mind, so I thought about.
that is what the answer also you should have it I do not district I don't criticize you I encourage you you have done a very good question but the answer is did you study deeply about this topic
Little bit, not much.
This is where everyone is. You answered the question of everyone, my child. God bless you. We study little bit of everything and we become jack of all trades, master of none. Not even jack. We become dancer of everything and our dance become Bhangra dance like this. Boom, 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 boom. We speak of PI stroke. Whose stroke patient recovered very fast. As a big stroke, PI. Try will recover itself in 3 hours.
Okay, sir.
ऐसा बात तो आपकी बात नहीं कर रहा बच्चे के लिए कर रहा हूं सब्जेक्ट एक ही बन से बदनाम कहां से हुआ क्यों because you could not give evidence to the recovery I gave evidence to the recovery लाओ उठाओ पेशेंट को एमआरआई पर देखो उसके लेशंस कम होते हैं कि नहीं होते हैं you say 3 months I'll make him keratoplasty in 1 month चलो करो I told the neurosurgeon do it what is the problem where are the lesions for me so there are no lesions how did you do it there is next question I'll answer you first do keratoplasty done Patient is singing song now. Do you want to hear the song of that person? Or did you see that video of a person?
Yes, sir.
Who that he can sing after large tracheostomy? Huh? A
Yes, sir.
complicated capsulogangular hemorrhage, massive hemorrhage, midline shift, such a big cut in his brain. Came to a coma state. Now he's singing. क्या बोलोगे उसको? He's independently walking. That stage से यहाँ तक आया. He is finding difficult to speak because broadcast is not repaired. Varni की तो repair कर दिया. You want to hear his song?
Yes, sir.
Yes, sir, I want.
Can you give me 5 minutes? I'll go to his room. कौन सा room number है वो? हरिहरनाथ का? पता करो पटक से.
सर थोड़ा पानी पी लो सर.
पानी नहीं पिया क्या? पता ही नहीं.
नहीं, गला सूखेगा.
याद ही नहीं रहता. बच्चे हो गए हम लोग. ये भी याद दिलाना पड़ता. पानी पियो, खाना खाओ, सो जाओ.
सर अच्छा लगता है.
इतने सीनियर फिजिशियन हो गए फिर भी ये बताना पड़ता सर आपको खाना खाना है. हाँ? खाना नहीं खाया?
नहीं खाया आज.
खाना बेटा मैं रात के 2 बजे खाता हूँ. आई एम ए डे एंड नाइट ड्यूटी आरएमओ. मैं रात की 3 बजे तक काम करता. इतने क्रिटिकल पेशेंट है. एक एमबीबीएस डॉक्टर लोग तो भाग ही जाए इन पेशेंटों को देख के.
सोते कभी फिर?
4 बजे 5 बजे 5 साढ़े 5 बजे उठ जाते हैं. फिर पढ़ाई में लग जाते. आपके स्लाइड्स बनाना, आप लोगों को पढ़ाना, आप लोगों को स्ट्रक्चर बनाना, 6 महीने में 5 साल की चीजों को समझाना, कितना फिल्टर करना, इतना आसान है क्या?
सब आगे का सब इजी हो जाएगा.
हाँ बेटा आगे का चीज इजी करने के लिए तो हमें इतनी मेहनत करनी पड़ रही है.
जी सर, हैट्स ऑफ टू यू सर.
एंड अप टू यू ने किसी ना किसी को तो इनिशिएटिव लेना होगा बेटा. 107. So we are going to room number 107, right? He can sing in Hindi. So give me 1 minute. I'll show you the case.
It's okay, sir. We will be
But
opening
he
our
is a
shoe
Hindi
shop.
singer. He cannot sing English song. But you see how beautifully he can sing. Better than you and me. That is why how I became a good research scholar. That by just subcutaneous needling, which everyone said he cannot even speak a word, is singing song.
So what was the
His
score
name is Haryana.
diagnosis? What was the score diagnosis for this patient?
He had large capsulogangular bleed. This skull was removed. He came to me in Glasgow coma scale 3 directly from ICU, which is near to death. समझे? Anything GCS is a coma scale. यानी वो पेशेंट कभी भी मर सकता है. वहां से यहाँ तक पेशेंट आया है. From coma of GCS 3 to 80% recovery and singing song. This is what I want to show you.
Excellent, sir.
And you will see right now. I'm going to the patient's room.
Great, sir.
What great? There is nothing great. Brain is great. God is great. You are great.
And what's his age, sir? What's his age?
70, 65, 70.
Okay. Okay.
And you sing, you will see how beautifully he sings.
Right, sir.
On the first floor. That is what I am saying, my children. This is what you have to develop in yourself. I am not a theoretical person. I am saying full practical. Any seminar student comes to me, I say, this is the patient, this is what I said, the 23-year orthopedic physician. We'll complete the class in 1 minute after the song. कौन सा room है? हरियाणा जागा हुआ है? Harianath, my Zoom students wants to hear your song. 1 minute. ये देखो, where is your brain surgery? Here you can see the brain surgery. And your tracheostomy was done. Ganchare ganchire.
कांचारे कांचारे पीती मेरी सांसी खुदा नदा दिल तोड़ के ओ सांसी देखा तेरे पीती मेरी सांसी खुदा नदा दिल तोड़ के
पहाड़ों
पहाड़ों
फूल
फूल
बरसाओ
मेरा मन डूब गया है मेरा मन डूब गया है ओ रानी तुम कमे मेरे खुदाने के ना 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 ना
और एक गाना सुनो
कहीं तो सब
भूल जाए साँझ की दुल्हन लाए तेरे आए
तेरे
ख्यालों
में आलम के तुझ पन्नों पे नींद आए नींद आए को दूर
कहीं
दूर
दिल बचाए सांझ की दुल्हन लड़ाए कैसे आए मुड़ मुड़ के ना देख मुड़ मुड़ के ना देख मुड़ मुड़ के मुड़ मुड़ के ना देख मुड़ मुड़ के मुड़ के ना देख मुड़ मुड़ के एक गाना और बढ़िया वाला You are seen by 16 countries.
देखा तेरे पीत मेरे साथे एकदा नजर तोड़ के ओ देखा तेरे पीत मेरे साथे एकदा नजर तोड़ के ओ देखा तेरी बस
बस Thank you. Hey, what is your comment?
Wonderful, sir. Beautiful, miraculous.
Then
This is
Amazing.
magical, sir, and many, many congratulations to
Congratulations.
everyone. Speechless, sir.
Congratulations, sir.
Speechless.
Speechless.
Congratulations.
Amazing, sir. Congratulations.
Amazing.
this is what I say, you have to learn. If you learn this thing, then only patient will come. Patient will not come to you for plain and simple things.
True, sir. I think this is one of the exemplary success stories, sir. Of course, all of your stories are truly exemplary, but this is like fantastic.
I'll show you more fantastic story. This is nothing. Every story is fantastic.
Right, sir. Well said, sir.
सर
Absolutely.
उनको इंट्रोड्यूस करके आपके चेहरे पे भी बहुत सारी खुशी दिख रही है.
मेरे चेहरे पर कभी दुखी दिखाई देता है?
नहीं नहीं नहीं, अभी जो और रिजल्ट जो मिला है उस वजह से
वो
और
तो
ज्यादा.
रोज सुनते उसका गाना. It's
जी
my daily
सर.
habit to hear this song.
जी सर. इतने सारे
Whenever
लोगों
he
को
come to my
introduce करवाया.
clinic and I try to clear each word of his word.
Yes.
Today I saw there were 2-3 words he was missing, right?
Yes.
Tomorrow I'll clear it. इसलिए मैंने बोला रिवीजन कोर्स को रजिस्टर करो, इसको रजिस्टर करो. आप लोग कुछ करते ही नहीं है तो मैं क्या करूं? ना पढ़ना है, ना पढ़ाना है, ना करना है, ना करना है. MRI रिपोर्ट की एक फोटो कॉपी भेज दो. Just send me a photocopy of MRI report. Say, please tell her how to do it. And one person went to such an extent, close the door. He's saying, sir, I purchased all the 4 pen. I've attended your 1 month course. Give me the fellowship certificate. I said, thank you so much. I'll murder myself, but I will not give you. You answer my 4 basic questions. If you are really interested to study, you must sit and study. आज भी MD मेडिसिन में और वो बैठ के पढ़ते हैं. Every day when he comes, when we came, we have done the procedures. We discussed everything so nicely in the car. Today when the new hematologist and pathologist came, we did the procedure very beautifully. Rather than I am saying anything, they were again and again calling me sir, 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 sir. And after day after tomorrow, again I am going to what? Do what? I learned from them. I forgot the procedure. Within 2-3 days, we are so intelligent. You saw us once. We'll go inside and we'll take out what? Bone marrow. The orthopedic will teach me how to do it from tibia. He will teach me how to do from iliac crest. Although I'm not going to practice it, but I should learn it to change my own mindset. I'm purchasing 5 lakh rupees microscope. For what? To do neurosurgery. Am I a neurosurgeon? No. But I do neurosurgeries. I like it. Because it opens my mind. It opens my mind view. Either you remain in the pond or you thrive in the ocean. क्या करना वो सोचो. मैं उस एंगल से सोचा जिस तरह से एक न्यूरोसर्जन सोचता है कि उसके ब्रेन को कैसे रिपेयर किया जाए. By just subcutaneous needling, I brought him to this level. From deathbed to this level, now he can walk also. Independent walking, climbing staircase. Now only these finger movements are left and some hand movements are left. I will do it. I got one robotic. I'm learning physiotherapy. I've learned Maitland techniques. I've read all the books of McKenzie. Now, as a physiotherapist also, you cannot come and say, I don't know physiotherapy. I have taught many physiotherapists in my life. Cannot tell me. Nor you can tell me I did not study homeopathy. I have studied Handman and all these books. I have a set of books. More than 40 lakhs books I have with me. Any more questions? Any more questions?
So
Yes.
you are inserting the needles. So you are inserting the needles to the patient side, no? So after how many sessions you will remove that needles?
See, all depends on the pathophysiology of the disease. Basically, I don't practice with the needles. My needling procedure is of 30 seconds. I just put the needle and I say them go home and remove it
Yes,
after 3 hours, 4 hours.
they can remove. They can remove the
So patient
needles.
remove,
Patients
which
can
our
remove
nurse
the
teaches
needles
them.
by
Yes,
self.
by themselves.
They
Yes.
itself can remove.
See, if I keep these patients,
So what are
140
the
people
points?
and two
So,
attendants, how many will become?
sir,
280 people in my room. See, when you insert something in your body for 3 hours, 4
yes.
hours, a continuous stimulus
Yes.
goes on.
Is there particular point is there for inserting the needles?
I told you I have no point. I'm not in, I don't teach points. I teach disease
Anywhere
and I
we
teach
can
recovery.
insert. Any
I
place we can
insert and
insert
take
the
a result.
needles.
You find, you try. You have patience now. You do
No,
whatever
it depends
experiment.
on the patient's diseases, no? Means which nerve are infected. So is there any
Where are the
point
nerve
for
connections? Where are the things that are the basic foundation I'm saying we have to learn? That is why I
anywhere we
said you
can
have
insert?
to, where to insert is, tell me, if I have a speech aphasia, where should I insert the needle?
In the head, no, sir.
Head, there's such a big head. Tell me, where to insert two needles?
Yes, that's the point I'm not understanding. Is there any point?
Go and find the point in TCM. I've read 246 books of acupuncture. I do not find the point.
Yes.
The Chinese professors do not know about the point. I
Sometimes you
met
are
many Chinese
inserting the
professors. 1 minute. I met many Chinese professors who are teaching acupuncture. They don't know this. When Udibong, who is a neurosurgeon, does not know this. I taught him how to do it. How to stimulate the hypoglossal nerve. We do it every day. Now also I do it. Go and see in my Facebook.
I'm seeing your Facebook videos also, sir.
You saw something, but then sometimes you are not able to see the clear procedures because you're trying to learn from there. Medical doctors
Yes,
cannot be
sir.
created like this. Only quacks can be created. First thing in PG is taught what? When you do post-graduation in medical college, you have to teach MBBS student. Why? Because it's all concepts should be clear. This is why India produces the best physicians when they go to US and all. When I treat the patients, my concepts are so clear that even I can defeat an anesthetist. You recover and so? Not sir. So what are your formulas? It is Papa 1, Papa 2, Papa 3. These are my formulas. Go and find.
Okay, sir. Thank you.
First is you must study the
Yes, sir.
foundation.
Yes.
The foundation is strong.
Study is the
Everything will never.
study is the most important.
Everyone has to study.
Yes, sir. Every point we have to study.
You are saying point. What point can recover a patient? Tell me.
Yes, that's the point I am not understanding. Where we have to
Because you do
insert the
not know the
needle.
foundation. How many years did
Backside.
you study acupuncture? Which books did you follow?
No,
Tell me the name of the books.
no, sir. I didn't follow any book.
Then how did you follow?
Acupuncture's books. Yes. That's why I
But
don't
you
have
are
knowledge.
very correct. You are very honest.
Yes, sir.
First has to study
Acupuncture knowledge
anatomy,
I don't have,
physiology.
sir. I want to learn. I want to learn from you.
It's okay. First, you have to understand anatomy, physiology of the body. How the body works, what are the
Yes.
muscles working. Then, the anatomical structures, how his heart is pumping. Where
Yes,
is the artery? Every surgeon must, when they do MCH, they study anatomy again and again. I study anatomy again and again. That is why I'm buying microscope. I'm buying 3 OT tables. 2 I've already purchased. Third one I'm purchasing today again for my own research.
So what is the use of microscope for me here?
How will I
Acupuncture.
see brain
I see.
the deficiencies? How will I see the arteries? Can I see with the naked eye?
No.
How will I use the forceps in the brain? Although the
So
brain
that's
is
why you are
dead,
using.
no
Yes.
one is genius. No one is like that. Then what is Hyperion? What is Lakshminath? What you need is a proper training, that's all. I'm training myself. So that when I go to Hyperion for 5 days also, I'm capable to do those things, what he wants from me. But that capability I have to develop my own. Then only he will take interest on me. Otherwise, he will ignore me.
No, sir, we can't ignore you. We
No,
want to
no,
learn from you.
not you.
You are
I'm
a
saying about
genius, sir. We
Hyperion.
want to, yes,
No, no,
we
I'm
want to
saying about
learn.
Hyperion. Hyperion. मैं Hyperion की बात कर रहा हूँ.
Yes, sir.
Why did I purchase 5 lakh rupees microscope when I don't have money? I sold my gold rings. What I will do with these gold rings? Someone gifted me 2 gold rings. These Kannada people are very thankful if you recover them. So they gave me gold rings. What I will do with this? I sold them. Now what I want a good microscope. And this microscope, I will study the brain. I'm purchasing the entire eye unit where I can recover the retinitis pigmentosa. When I'm recovering an eye, I must know whether the reflective errors are corrected or not. That I will know from the power of the eyes. I must have equipment, I must have devices. Whether neuropathy has been recovered, EMG and NCB will speak. Why I should speak? Reports will speak, not MK Sastri. Give me 2 months, then the reports will speak. And then after learning all this, when you get the certificate, then that certificate becomes what? A valid certificate. It is not a quackery certificate. When the court cannot deny that certificate, because you have learned, you have proved in yourself in your court, you are capable, you are doing good, and you will do good. Okay? It's too late. Thank you so much. Good night.
Sir, I have
Thank you,
a
sir.
question. Here.
Thank you, sir. Good night.
Thank you, sir.
Thank you, Dr. Sastri.
Thank you, Ms. Winnie.
Good night.